Hello and welcome to Understanding Emotions. My name is Sankalp. I'm a DPhil student in psychology at the University of Oxford. Today I have a special guest with me. This is Dr. Sanchit Turaga. He is a doctor at the UK's National Health Service, and he's also a DPhil student in medicine at the University of Oxford, which is how I know him. He is interested in health and longevity and all things relating to this fascinating human body and how to keep it as healthy as we can. So today's discussion is going to focus on health. We're going to talk about some foundations of health. We're going to talk about the basics and what everyone can do to enhance their health. And then we're also going to spend some time talking beyond health, which is some like cutting edge things about longevity, biohacking, things like that. So I am excited for this conversation. So welcome, Sanchit, to the podcast.
Thank you, Sankalp. Thank you for the introduction. Hopefully we can have a nice conversation about all of these things. And I think it's a topic that is quite in vogue right now, and especially longevity. And we can have a think about, all the things that we can all do.
Yeah.
I'll do my best to try and stay as accurate as I can. But obviously, if I don't know something, I'll say I don't know, or, that we need to refer to something, and then we'll take it from there.
Sounds very good to me. So I wanted to start at this place, which is this human body that we have. And obviously, it's quite fascinating, a lot of processes happening at once. And there's so many things to that keep us going. And with that also comes this territory of upkeep and maintenance and thriving and optimal health and all of that. So if you were to crystallize what are some foundations of health that, no matter who you are, as long as you're a human being, these are the foundations for good health, what would they be?
Yeah, so I'm not going to say anything totally groundbreaking. It's things that you've all heard as kids, basically, that, first of all is exercise. I'm sure everyone it's been drilled into you that you need to do, this amount of exercise. I think the NHS recommends at least 30 minutes of moderate intensity exercise a day. So that's, if that was 5 days a week, that would be 150 minutes, or you divide it into more concentrated sessions, for example. And then diet, trying to have a balanced diet. And we can get into more specifics on that. So if I would say 3 things, it would be exercise, diet, and then 3 would be sleep. These are the most obvious things that we can try and look at. And there's a very good book by Matthew Walker, actually, Why We Sleep, which I highly recommend, actually. There's a sleep scientist. So 3 main things, nothing groundbreaking. And then we can go into a further discussion later about sort of supplements and other things that you can do to try and boost that. And not particularly path breaking, unfortunately. But, these are the 3 things that we can't avoid.
Right. So this is something that even my grandma would be able to tell me.
Yeah.
And yet there's something about health which is very few people. If you look at all sorts of statistics about heart health or obesity and things like that, it's not easy. Simple but not easy is a phrase that comes to mind. So before we sort of go into the nuts and bolts of each one of these, why do you think it's so hard then, given how sort of simple and easy it is to just phrase what's health?
Yeah, as in, why is it hard to adhere to diet, exercise, and sleep, you mean? Or just generally to stay healthy?
Yeah, why is it hard to get the basics right?
Yeah, there's lots of different factors from what I've seen. And, I'm not an expert. I rely on, subject matter experts. So, I've done some training in internal medicine, which is sort of the general medicine of the hospital. I'm now doing a PhD or DPhil in a little bit of aging and immune system aging. So I am also gaining knowledge, and so then this is what I've learned from people that I've worked with, things that I've read through various subject matter. So in terms of diet, obviously that's just a huge problem, right? So why are people, struggling to maintain a diet? Part of it is obviously the environment, and there's a really nice book that came out recently by a UCL professor called Chris Van Tulleken, looking at processed food. So things like processed food is a big problem from diet perspective. And if you look at, in the past, say in the 1970s, before all these processed foods came in, people were eating fewer calories because less calorie dense food, and then also less processed food. So one of the factors, again, this is it's a multifactorial issue basically. Exercise wise as well, part of it is cultural, whether there's time to go to the gym based on your work schedule, ease of access, cost, and the same thing with cost as well, that unfortunately for diet as well, more calorie dense food tends to be cheaper compared to fresh fruit, vegetables, this kind of thing. So lots of different issues. And then coming to sleep, again, time is an issue, bad sleep hygiene. So multifactorial issues.
Lots of things.
And each one of them has, specific people looking into it, doing research into all the different things.
Right. Sure. So lots of things. So I think the best way to go about this is let's go step by step. And I do also want, I know a lot of people care about, not getting sick, which if that's a thing at all, but things like the cold and things like that. So we're going to go into that as well in a bit. So just to start with sleep, let's say, I understand, being a neuroscientist, I am surrounded by conversations about sleep, and I understand that there has been a sort of cultural shift in the last few years about going from thinking of sleep as like a nuisance, something that we have to sort of do, and we should optimize or cut corners there as much as we can in the interest of productivity, to today's day with Matthew Walker and other people just like sort of saying that, look, sleep is not just a good to have, but it's a must have for healthy functioning. So just walk us through what sleep is and why is it so important for health, like what does it do, and whatever you can talk about to cement the importance of sleep, so to speak.
Yeah. So, I'm really happy to talk through what my understanding of what the literature is. Again, I'm not a sleep scientist. Sure. So, my understanding is, from a medical perspective, is it's your body's way of recharging, and it's a way for the body to repair damage, clear away waste in the body system effectively. And so we know from research and clinical studies that if you don't sleep, that has a huge impact on both your physical function. People are at higher risk of heart attacks, strokes, so many diseases, and then also mental function. It affects your risk of mental disorders as well. So it's important for both your physical and mental health. So it's really crucial.
Yeah. From a medical perspective, have you seen like a rise of people reporting insomnia, and what's your sense around insomnia and sleep disorders in general?
From a cultural perspective, yeah, I think there was a study that Americans, for example, the recommended is 8 hours of sleep based on some studies, and people are getting much less than that. People are getting six hours of sleep. So that is a big problem. Obviously, part of that is work schedule, things like caffeine, alcohol, and then sleep hygiene. So, devices at night and the light that's emitted, and you're constantly being stimulated. So all of these factors, I think, are contributing from what I've read and from what I've seen.
Yeah. And what are like things that physicians are recommending these days when someone presents with, hey, look, of course, I'm not going into the territory of, let's say, sleep disorders, which might be like a whole different line of diagnosis and treatment. But just, let's say, you get someone who is, let's say, just like losing a little bit of sleep, they're presenting to you with this kind of sleep issues. What are some like generic guidelines that you have that people should go through if they want to improve their sleep?
Yeah, I think it's something that we generally as doctors need to do better. And often there's the whole medical, I think, there's a medical philosophy is more geared towards, let's treat you when you get sick. But there's slightly less towards, preventing you getting sick. And part of that is also to do with time and, resources and more patients, less doctors, less time. So yeah, I mean, if someone was presenting with a sleep issue, they wouldn't necessarily present to me. They would probably go to their GP and say, I'm struggling with sleep. So, initially, the GP would probably recommend them the NHS sleep resources. And in general, I would say as the safest sort of resource that you can look at for non-medical professionals is NHS websites, at least in the UK. They've got really tailored, specific edited advice. So they would talk about things like not having caffeine too late in the day. Sleep hygiene would involve things like making sure that you go to bed at an appropriate time. So, let's say you've got to wake up at 7 a.m. and you need 8 hours of sleep. That means, being in bed before 11 p.m., for example. And then things like making sure that your devices are switched off, you're not, or put to the side, you're not constantly being stimulated. And then again, avoiding alcohol too late as well, because that can disrupt sleep. And then there are other things, specifically, they say that being a little bit cooler at night because your body temperature drops at night is an important factor as well. So that's my understanding of sort of what briefly they might say, and then recommending a trial of those kind of things. But also it's an investigation to like why this person is not sleeping as much. Is it just to do with a behavioral habit thing like I discussed? Or sometimes people have got depression, or they've got a mood disorder, or they're stressed at work, or something else is causing them to not sleep. And the sleep is losing sleep is a symptom of what's going on rather than a problem in itself. And sometimes it's just behavioral. So,
yeah. But I think to sort of go back to the overarching picture a little, it is, you would say, well established now that sleep is important and we should be prioritizing it, as opposed to sort of this whole sometimes there's like, especially in like undergrad colleges and that kind of environment, it's a bit of a celebratory thing that I stayed up all night and kind of thing. So at this point, are you convinced that we have to prioritize sleep as far as health and general well-being is concerned?
Yeah, absolutely. I think, and I will 100% put my hand up and say that I have not adhered to the, at some point to the official guidelines. I'm sure we've all, including the sleep scientists, have probably pulled an all-nighter for an assignment, or you were having a celebration with your friends or something like that. Yeah, 100%. I agree that there is a bit of a culture where you say, oh, well, you're a stronger person if you're able to go without sleep. And, there's a sleepers for the week, and you get lots of these, even world leaders, right? I think Donald Trump boasts of not sleeping very many hours. I think Margaret Thatcher said she didn't sleep very much. Tim Cook, the CEO, says, oh, I wake up at 4 a.m. and so there's a lot of these sort of leaders, celebrities, and there's just this general culture of people saying, actually, I don't need any sleep. But then obviously there are very few people, that have got that actual specific genetic abnormality that means that, they can get away with not sleeping. And for the rest of the 99.99 or whatever percentage of us, it is having an effect. And I think a lot of the people who say that they don't need sleep are probably just depriving themselves.
Yeah, makes sense. So I guess what I'm hearing is it's probably okay if it's one off or something like that. I mean, we were out yesterday night and we had the first conference here in this discussion. But I think, as a general trend, we have to focus on that, and it's useful to maintain your sort of circadian rhythm and like have that maybe go out to bed at the same time, wake up at the same time, to the extent that we can.
Yeah.
All right. So thanks for telling us about sleep. Just before we leave this topic, and of course we can circle back if anything comes up, but is there anything you would suggest people do to improve their sleeps that is sort of generic, doesn't have to be, I mean, you can't give specific advice, of course, but if there's anything that, you would recommend people are like maybe not doing right now, which you see in your practice or in your friends around you, that might be helpful, like some actionable tip?
Yeah, I think this is all advice that's available, but the obvious thing is just devices, and I'm guilty of this as well. Is just using your device as late at night. and there's something that says that, the blue light in your screens can keep you awake for longer. So some people have various blue light filters on their devices, but even then, it's just the light itself. You're basically confusing your body's internal clock, your circadian rhythms, to say actually it's daylight, and then your body gets confused, thinks that it's not time to sleep, and then obviously that disrupts your sleep. I think currently in the modern world, that's like the number one thing that I would suggest. And then obviously the general sleep hygiene stuff that I talked about earlier, and there's a lot of this is available online as well. And then we can specific stuff would be, if you then are still struggling to sleep, all of your other issues like depression or whatever else is all sorted, then your specific medical professional will refer you to a sleep clinic, as it were. And so I did a job in neurology where we had often people coming in for sleep studies for whatever sleep disorder that they were thought to have. So they'd be referred to a specialist for that. They will do a sleep study. It's called a polysomnography, basically. And then they attach a bunch of devices, and then you basically sleep. And then they look at the electrical wave pattern of your brain, basically, and then try and use that to understand what sort of sleep disorders you're having. But then that gets very specialist. And then, at the moment, again, in the book of Why We Sleep, it's a really nice summary of why actually there are lots of sleep drugs going around. But, the impression is that a lot of the drugs are sort of artificial, and they're not, actually improving your sleep. So there's no magic bullet, unfortunately. It's just try and get more sleep, reduce the factors that are stopping you from getting the sleep, essentially.
Yeah, it's a very good point. You may be better able to answer this with the sleep drugs. I know that some people think that no matter how bad it gets, ultimately there's this savior pill that I will have. And so do you know what these drugs, how good are they, or are they even helping with sleep? Like what are they? What are they doing?
So my understanding of it, from what I've read and learnt and seen in practice, is that in fact these drugs are not recommended for long-term use. It's not. You shouldn't be taking a sleeping pill every day. It's a short-term thing to try and fix something in the short term. But overall in the long term, it's not going to help you. So essentially how they work, without getting too technical, is they act on various receptors, try and promote basically the calming down of your brain, and try and promote sleep. But I think people have done some studies, and there are there's 4 stages of sleep, stages 1 to 4, and I'll leave our listeners to go ahead and look into that, because I don't want to get too much into the depth. But they call the stages of your sleep, they call it sleep architecture, as it were. And they say that in the long term, you're not actually properly improving your sleep. It's sort of if you wanted to sleep, it's sort of not quite knocking you out, but this is my understanding that it's not a long-term fix. And often people tend to get addicted to sleeping pills as well, and that's a big problem.
Yeah. Are they they're not fixing sleep, so to speak, right? They're not forcing you to sleep. They are, I don't know, enabling it.
Yeah, it's sort of like making you a little bit more drowsy. So I think my understanding is some of them act on GABA A receptors, for example, and they just try and calm things down. Very simplistic explanation. Neuroscientists, please do not kill me. I am not a neuroscientist, disclaimer.
Yeah. No, not at all. And I'm sure people understand that. Let's move on to exercise. So this is often described as the second pillar of health. So just like with sleep, like why do you think that exercise is so important, and what has been like sort of the cultural uptake of it from your practice experience and what you see around?
Yeah, I think exercise is really, really essential. Obviously, for some people, it is much, much more difficult from a medical perspective. Let's say you've got specific knee problems in both knees, that makes it much more difficult to do running, but maybe you can do walking. So it is so essential to try and get your required amount of exercise, both from a sort of calorie perspective, because, you know, in terms of maintaining weight, I just like to think of, it's simplistic explanation, but you like to think of like a bank. So you put in food, and that is like a deposit at the bank, and then you take stuff out. And so if your weight needs to stay the same, what goes in must match what's coming out through exercise. And so part of it is your sort of calorie weight maintenance. And second bit is it's also been proven to, it's been shown that it affects your health in general, all the organs, everything else, your immune system, for example, helps maintain that. And then also mentally as well, helps maintain your mental health. There's lots of studies showing that as well.
Yeah. And in terms of exercise, I know there is some generic advice on, let's say, the NHS website of getting, I don't know, it's 30 minutes or something per day. And then you obviously have a lot of pseudo health experts like bodybuilders and so on, who would have their own set of advice. So if, like, let's say your average person who goes to a job, let's say they do a 9 to 5 and that kind of thing, what would you recommend they do on, let's say, a more low commitment level, and then someone who's like more committed to exercise and things like that?
Yeah, I think it's, there's been so much written and so much said about like diet and exercise. I think from a practical perspective, whatever you think you can do consistently and will actually work for you in the long term is the best thing that you'd recommend. So obviously, if you don't really go for a walk, for me to say, oh yeah, make sure you do 5 to 10 mile runs 3-4 times a week, it's not going to be a practical, actionable advice for me to give you as a doctor. So if I said to you, okay, try building up from, let's go for a walk after a certain time of the day after you come back. Or I will recommend, say, what sport do you like to play? Do you like to play tennis or whatever else? And say, try and do some tennis. And then you try and build it up from there. Obviously, there's the ideal, and then there's what people are realistically, practically able to achieve because of a combination of like life factors, motivation, everything else. And so you gotta try and match those two things together, because there's the ideal, like you said, right? NHS website says you should do some strength training, you should do some cardiovascular exercise, and those are sort of what's recommended. And then obviously most people don't do that, and that's a problem.
Yeah. So one feature of the listener of this podcast, and I guess in general podcasts like this, is they are bit too obsessed, if not so they're more on the side of how do I, like, give me everything kind of thing. So there is obviously that person who has to sort of start and wants to start, and I think what you said wonderfully applies to them. But let's say someone is on the other end and they want to ensure that they're getting a higher level of, they want to be in, like, let's say maybe they're a low-key athlete, or just want to ensure that they're aging well. I'm gonna go into longevity in a bit, but so I heard what you said was, one is like, let's say, strength, like musculoskeletal sort of training, and then there is cardio, heart, and that kind of health. Are those like the two big pillars of exercise, and am I missing anything?
Yeah, I think so. I mean, obviously, for the sports enthusiasts, the sports scientists out there, I'm not going to pretend like I have the level of knowledge to advise an athlete, because there are sports medicine doctors, there are physiotherapists, there are sports scientists who are all much, much better than that, than me. But yeah, I think, I don't think most people would disagree that strength training, so, it's not, I wouldn't necessarily say, not even, lifting very heavy weights like bodybuilders, low level weights is also, there's evidence to show that strength training, not just in young people, but in older people, helps your general sort of quality of life. And then we can talk about longevity and things. And then, cardiovascular exercise, so that's running, rowing, playing a specific sport that involves you running around, for example, both of those things are important.
Sure. And in terms of frequency, is it better to do long spurts at single time, or is it better to, like, spread it out a bit. I'm thinking in perspective of like someone who wants to like is perhaps inspired by listening to this and wants to do something. How should they go about this in terms of frequency?
Yeah, I think rather than giving a generic thing, I think, you know, every person has got to think about their schedule as well, and then try and see how that fits in. So let's say you're a busy person and you're working an office job for, you know, from 9 a.m. to 9 p.m. You know, for me to say, oh yeah, make sure you go out and do a 15-mile run before you go to work when you're dead tired and you're getting 6 hours of sleep, you know, that's going to be a problem. So you need to look at your individual circumstance. In terms of length of exercise, I mean, that's a huge debate. Obviously, one is the intensity of exercise, something that gets your heart rate up. So, you know, brisk walking can do it, running, and other types of cardiovascular exercise that I mentioned. And then lengthwise, obviously, there's a big school of thought now coming out about high intensity interval training. So you do short bursts of really, really intense exercise. And people say that that has lots of benefits that are similar to a longer period. For the athletes, obviously, they will be training for their specific sport or event. So, you know, someone like a Usain Bolt who trains for a 100-meter sprint will not necessarily be doing marathons because there's, you know, different types of muscle fibers that are involved in different types of length of movements, for as it were. And the same with, you know, a marathon runner will not be practicing relatively sprints that, you know, a Usain Bolt would be doing. So there's sort of different types of events as well, and sports and things and ways that different people train. But again, disclaimer, I'm not a sports scientist, so yeah.
Sure. Yeah. I mean, that sounds good. That sounds good for us to get going at least. And I mean, if not that I'm an expert either, but I have published what I do. So if you're interested, you can have a look, more for inspiration than anything else. And I try to, one of the mistakes I made, I suppose, in my, I don't know, life is going into exercise but not necessarily having a balance. I would be lured by, let's say, jiu-jitsu at some point, and then all I would do is jiu-jitsu and like never sort of train strength and never even cardio for that matter. It's a very specific type of cardio that's trained in jiu-jitsu. Or at some other points I would just do dancing, or some other points I would just do weights. And not to say that's wrong, it's probably better than not doing anything. But I do feel right now that I combine a lot of things like cardio, I do a little bit, I do strength. I feel like just more like a holistic sense of health rather than maybe like training for one specific thing. So I'm just curious, what do you do? Of course, it's just more inspiration.
Yeah, so I mean, I wouldn't necessarily follow my example because I don't think I'm an example. Yeah, I mean, I 100% agree. I used to be like that as well. I used to like running more than any kind of weight training, just because, you know, I was sort of told, you know, oh, don't bother weight training. That's like only for bodybuilders. Again, you know, this is sort of the way, you know, people you grow up around, like at the school that you went to or whatever, the cultural area. And so I used to do more running and then playing things like tennis, badminton, all sort of cardiovascular type exercises. And then, you know, some friends said, oh, let's go to the gym. And they taught me how to sort of do the lifts, which, you know, I still may not be doing properly. So, you know, there is a knowledge barrier, especially from the weightlifting perspective, and that's you know, not to the level of, say, you want to become a powerlifter, but even to do the regular exercises, you need to know to some extent like what you're doing so that you don't injure yourself. And whereas there's slightly less of a knowledge barrier to, say, to going running, right? Although yeah, there is lots of knowledge in running properly and not injuring yourself. Yeah,
but I guess one thing I would like to sort of say is it's good to look at balance in general. I think I do feel the difference when, rather than just developing one thing out of mostly what friends are doing and that kind of thing, it did help me to get this 360-degree overview and see what's optimal for my body. But let's move on to diet, and this would be like the third pillar, and then we'll go into more of beyond health territory, which is also very interesting. But let's talk about nutrition, diet, that kind of thing. The first place I want to start with is my impression is from reading a lot of like diet related material is the medical sort of education sort of lacks in providing information about nutrition, or proportionally doesn't have enough training. So just on this cultural point, do you have any thoughts on are doctors not taught as much about nutrition as much they should be knowing, or is it just marketing more than anything else?
I mean, I wouldn't say it's 100% marketing. Obviously, there's so much that you need to learn in medicine, and limited amount of time, and we're trying to cram in as much as possible. New stuff gets discovered every day. That being said, I think I do agree that we should have more training in nutrition. But again, so much of the advice is changing, right? There's there was a focus on, low carbohydrate diets, and, and then, there have been studies saying that actually comparing a low carbohydrate diet and a high fat diet, or having a low fat diet, for example, or a high protein diet, and all of these factors have been sort of compared. And if someone is following a specific diet, I think my understanding of the studies is essentially they're all kind of similar. And so there'll always be like a new diet, there'll be a fad diet. So, from TV, people might have heard like the 5-2 diet. So, you sort of eat slightly less and then you binge at a shorter period. You might have seen lots of celebrities doing cheat meals where they'll sort of eat very restrictively for most of their meals, and at one point during the week they'll eat lots of food. And essentially, broadly speaking, calories in, calories out, as long as you're still maintaining that balance, then lots of the diets have similar sort of efficacies. Obviously, you shouldn't be eating loads of high fat and high carbohydrate food that is unhealthy for you. And there's specific guidance on NHS and other websites about how much you should be eating in terms of fruits, vegetables, and everything else. It's a huge topic, but we can discuss specific bits of it, definitely.
What you may not remember this, and it's okay, but what is the recommendation around how many fruits, vegetables, or servings, that kind of thing?
I mean, there was a big public health campaign about 5 a day, like get your 5 a day. So that's like 5 portions, and I can't remember what the portion size is, of fruit or vegetable a day. Again, I'm not 100% sure about the evidence base, and this is the problem in nutrition, is that evidence base is still growing. We're still understanding more about what is important in diet, obviously. And then more recently you might have seen there's a trend towards vegetarianism and veganism. So there was an interesting Netflix documentary that came out about called The Game Changers, about vegetarian athletes. And I'm sure, I don't know whether you've seen it, because I think you're vegetarian, right?
I am, yes. I have seen it. It was so I didn't grow up vegetarian. I was a heavy meat eater, mostly because of my family, and they're perfectly healthy. I was not. I was just feeling a bit unhealthy when I was starting my PhD, and that's when I did a lot of research about what kind of things I should be doing in terms of diet. And I realized that it's not the meat itself, and this is obviously personal, but it was more that the lack of vegetables as a result of focusing on the meat. So I think especially with the gym culture and protein, sometimes it becomes the case that you just end up focusing on one narrow thing, which is protein, and then miss out on, for me, there was this huge mind-blowing moment I had when I realized that there's something called as micronutrients.
Yes.
Which probably predict health much better than just, calories in and out, although obviously there are different levels of analysis. That's when I basically saw the Game Changers thing. So is this, with this different diet styles, is it clear right now that all of these different, let's say vegetarianism or meat eating or whatever, they all can be equally healthy provided you do it right? Or
I mean specifically, I'm talking about for weight loss is what I was talking about in terms of diets for weight loss. I mean, in terms of general longevity, my understanding is that the studies are showing that high red meat diets, for example, might increase your risk of various cancers like colorectal cancer. But again, I think more information is needed, and I can't claim to have read all the studies basically on this, and it's just too vast.
Too vast.
I mean, I think if we're following a balanced diet, people can eat meat. Whether becoming vegetarian is good for you in the long term, maybe. I mean, my personal suspicion is probably because of the way meat is like processed, and they talk about this, I think, in Game Changers as well, which seems plausible to me. Like you're generating lots of things that might cause cancer, might cause damage. So yeah, I mean, from that perspective, you would, it seems plausible that a more vegetarian diet might promote longevity. But again, I would need to look into more of the studies into the area. But also, I think there's more evidence needed, to be honest, like proper, randomized control trials, and then a systematic a review and a meta-analysis looking into all of that. I mean, there are lots of individual studies, and so, for example, Game Changers was criticized afterwards for cherry picking studies to sort of promote their point, because they criticize the meat industry for promoting meat eating as, like you said, right, this culture of I'm going to be a bodybuilder / strong athlete and I need to eat loads of meat and protein, and they were sort of challenging that, but then they got criticized because they were picking certain studies. So it's a tricky, difficult topic, and there's no sort of easy, honest answer. And then also there's the practical aspect, right? Coming back to the same thing of, if you tell someone who's been brought up, meat, actually, you need to stop eating meat. It's going to be very hard for them to give up.
Yeah. Practicalities is a big thing when thinking about these things. And I think you've said it, that that we do need more studies. Like, I don't think it's conclusive. Like, I've clearly seen people who are vegetarians and not healthy. I've seen people on the exclusive French fries diet, and just because it lacks red meat doesn't mean anything, right?
Well, exactly.
That kind of thing. And obviously, I've seen people who eat meat who are flourishing and thriving. So there's just more needed to sort of disentangle a lot in this area.
Because that specific person, it's not the only thing that they're doing. If they're eating really healthily, probably they've got more motivation to exercise and do lots of 100 other things that are keeping them healthy. So is it the diet? Is it the everything else? It's really hard to tell, which is why you need all this, a specific study that looks into it.
Right. And just to conclude this nutrition point, just like I asked you in the previous two, if there's one action step you could give to the listener, what would it be?
Yeah, I mean, I think in general, if I speak for British population, for example, I think the government and all of our health epidemiology data says that we don't eat enough fruits and vegetables, and we don't follow a balanced diet from that perspective. So that's just the easy step, and that's why there was that public health campaign, right? And then if we get into specifics of, actually you should have less rice, less bread, that's where it starts to get difficult, because there are different proponents of some people say you should go keto, and some people say you should do this, and but like you said, equally there are people in other studies who have followed a normal carbohydrate diet and still lost weight and still maintained their health. So it's not that one specific diet is the best, as it were.
Yeah, makes sense. So this might be the toughest question I would ask you. Does an apple a day keep the doctor away?
Probably not, I think. It depends on what other things you're eating with the apple and your whole life around it. I wish, yeah.
Fair enough. All right. Speaking of more like foundational health, what supplements, if any, should one take to stay healthy?
Yeah, I mean, I think the official line is that if you're following a balanced diet, because like you said, right, there are sort of 4 bits of things that you get from your food, right? The building blocks, which is carbohydrates, like things that are in, like, say, refined sugar, bread, and then there's proteins, things in meat and so on, and then fats, and then followed by micronutrients, which is what you mentioned. So things like vitamins, minerals, all this sort of stuff. Yeah, I think what should you do? I mean, it's hard. And just come back to that question again. What was just remind me, what was your main?
Speaking of let's say like foundational health. Like, so we talked about sleep.
Yes, what
exercise,
supplements,
medicine.
right? Yeah.
What could you use?
So yeah, the official line is you shouldn't need to take supplements if you're on a balanced diet.
Yeah.
That being said, for example, if you're in the northern hemisphere, we are in a sunlight deprived area, shall we say?
To the least, yeah.
So there's studies showing that people are completely vitamin D deficient, and so yeah, for a lot of older people, we do supplement vitamin D because there's lots of evidence to say that it helps maintain your bone health and prevents fractures and helps maintain this. Maybe strength is not the right word, but it's probably the easiest word to say, like the strength of your bones. So I think if I'm not going to recommend it as we were, but taking a multivitamin is pretty harmless. So I think if there's one thing that you could easily recommend to people is to taking multivitamin. Again, lots of doctors are just sort of like, oh well, it's expensive urine, and if you're following a balanced diet, you shouldn't need all of those things. But let's say there's 1 month that you're not eating whatever specific micronutrients, or there's not a lot of sunlight, and you're getting vitamin D. I think from a risk benefit, every intervention that you do in medicine and just in life, right? You do a risk benefit analysis. You say, actually, the risk of you getting pretty sick from a multivitamin, pretty low. Yeah, okay, you might lose a few pounds money wise. So, you might lose a little bit of cash, but then overall for maintaining your vitamins and minerals, I think it's pretty low risk intervention to try. And then obviously there's the whole range of supplements that all the longevity enthusiasts and biohackers take, which we can discuss, I guess.
We'll come to that. What are your thoughts on green sludge? That is, do you know what I'm talking about? Like these green powders that many companies sell. I don't want to name because there are plenty of them, but they are their marketing is very, very strong. And so is it just another glorified multivitamin, or are there any pros or cons to?
Yeah, I mean, I'm not going to comment like you said on a specific company. Yeah. From when I've seen, it just seems like a glorified multivitamin.
Yeah.
And what they do is they'll say, but we've got a special formulation. And then the thing I always think to that is, where's your study proving that this special formulation? And the thing is, those studies cost a lot of money. Like they probably cost millions, right? And the thing that we have to remember about the supplement industry is that it's unregulated, not unregulated, but it's not regulated in the same way as, say, a drug. Because if I'm giving you a drug for high blood pressure, that goes through all the phases of clinical trials. It has to get tested, and even after it's released, it's monitored.
Yeah.
So. But I could just start a supplement company, and lots of the enthusiasts do, and they just say, okay, here is my specific, I don't know, whatever supplement, melatonin for sleep, for example, and say, Sankalp's melatonin, buy it now today, and you'll say, this is the best melatonin you can get out of the market. But no one's going to sue you if that's not true. No one is checking the specific contents. So let's say you say there's 1 milligram in each tablet. No one is actually analyzing the content of the pills to say, actually, is it 1 milligram or is it actually 100 micrograms? No one's testing the quality of your manufacturing. So that's a problem because, 1, is it actually what you're getting? And 2, is the dose actually what is advertised? So yeah, coming to the green powders thing, I think probably multivitamin, and then coming back to this whole broader supplements thing where it's not as regulated. So they can say not quite what they want, but they can make probably bigger claims than they can justify with the evidence, which is a problem for it's a problem for me as well as the average consumer, right? Because even I have to sort of really look into the fine details, and then if someone who doesn't have as much of a science basis, it's hard for them to figure out, right?
Right. Yep. So we'll leave the conversation about supplements at that, and it may come back when we think about longevity, because a lot of it does revolve around it. But to switch gears a bit, a dream of mine, a priority of mine so far has been to socialize. I study social relationships and their impact on health. And I try to sort of be social as a person and go out and that kind of thing. But a huge liability of that has been getting sick more often.
Yeah.
I mean, I've had conversations with my GP about this, and I do still fall within the normal bracket, but probably more on the upper side of normal than most people in terms of getting colds. And it has a clear reason for why. Like, I travel more, I socialize more, and that kind of thing. And there is this allure of, like just fine tuning your nutrition enough or fine tuning your supplementation enough that I can reduce the symptoms / the duration of the common cold, or the holy grail, eliminate it altogether. And so is that just a dream, or do you think there's some progress to be made?
Yeah, something that's interested me as well, because, when I first started like the clinical part of medical school, so in the UK medical school is 6 years. So 3 years you do the science of medicine, basically, and you sit in lectures and learn science and go to labs and things like that. And then you spend the last 3 years basically going to wards and learning about like clinical medicine and how it works and that kind of thing. So I remember the first month or few months that I went to clinical medicine, like you said, just meeting so many people, getting sick. And yeah, it's something I looked into and read. I mean, the common cold basically is actually any kind of what we call an upper respiratory tract infection. So basically like your nose, right? And lower respiratory tract is your lungs and getting pneumonia and that kind of thing. And actually, the common cold is probably caused by hundreds of different viruses.
Yeah.
And there are different families of viruses. So one of the families of viruses is coronaviruses, of which obviously COVID-19 was a coronavirus, but it's like it's a family of viruses. So there's coronaviruses, there's rhinoviruses, rhino meaning nose. So, sorry. Yeah. So, the problem with that is that, when you've got COVID, we're trying to target a vaccine to beat one virus. How do you do it against 300? That's a problem. In terms of like, how do you deal with it practically? Yeah, I mean, it's something that we're all dealing with, right? You shake hands, you might hug someone. It is sometimes, unfortunately, inevitable that you will get sick. Simple things like hand hygiene, I guess, is really important. So, washing your hands before and after let's say you go out for something and you come back home, washing your hands. Part of it is that these infections sometimes are droplet infections. So some of the infections are you sneeze, that creates droplets that are in the air. They fall on a surface or on you. You touch it, it goes into your system. And then some of them are sort of floating around airborne, and that's more of a problem.
Right.
It's difficult also because, you could say wear a mask, and, people still do that. And, it is important when, say, you might be in a confined space or obviously COVID, that's and unfortunately it is still around, nowhere near to the previous pandemic extent, obviously.
Sure.
But then, you're going to a social event. Now the risk of COVID is much, much lower. There's no legal requirement to mask up. So then saying that you're going to go to a mask, you might prevent some coughs and colds, but then there's the social aspect of it, and that detracts from that. So it's hard.
Yeah.
There's no easy answer. I think people are looking into it because I think I read that it costs, in terms of productivity, people staying off sick with the common cold, it's costing billions probably. So
Yeah, I was sick a few weeks ago, just a little bit, nothing too much, just a regular cold kind of thing. And I did look into zinc, and you commented saying, that there is some evidence for zinc. So I'm just curious if there's like elements like that people should know about that is worth at least discussing with their
doctors.
I
mean, I so obviously I think it's worth highlighting now, like sort of the levels of evidence of things. So obviously the way that we evaluate, and way I think everyone should evaluate, is there's like a nice pillar of evidence, which I don't know whether you might be able to put up as a graphic, but there's the bottom is like expert advice, or people because that's filled with biases. Then you followed by, smaller scale studies. And then, the gold standard is randomized controlled trials where, I can't force you to go into a group where I give you the drug or an intervention or don't give you the intervention. It's completely random, and it will be double blind. So I don't know what you're taking, you don't know what you're taking, because that can bias the results. And then the top of that is a systematic review of all of those things. So you look at all of the gold standard trials and you combine them, and then you say, actually, what's the overall effect? So I think in terms of the common cold that's been analyzed, people have tried vitamin C, people have tried lots of things. They say that, I think, taking vitamin C reduces, from what I remember, the duration of your cold by 8%.
Sure.
And so I think on balance, people say, actually, here's the cost of the supplement, and actually it's going to reduce your duration by 8%, if that. So is it worth taking it at all? Which is why there isn't like a specific supplement, and it's mostly rest fluids. Yeah, I mean, and then some people try and take zinc, again, some evidence. So yeah, once again, more trials, but then is it worth the marginal benefit? That's something that is tricky, which is why I don't think it's not recommended that you take a specific supplement, because the problem is, to recommend something to someone, one, you need to have not as many side effects. Obviously, everything comes with a additional or side effect, and it needs to have a good enough sort of benefit. Let's say there was a new supplement that came out that said reduce your risk of 50%. Then we start discussing, actually, is this worth taking? If it's like 5%, this is it becomes a discussion of is it worth it?
Is it worth it? Yeah, makes sense. So yeah, hand hygiene, I guess, is quite a actionable thing. I do try to carry a travel sanitizer everywhere I go, especially if I'm traveling on planes and subways and that kind of thing. And subjectively, I do think it's helped, but also, like, you never know, that kind of thing. It's just a small window of opportunity that the viruses need to invade.
To invade, yeah.
Yeah. In terms of, like, there's a lot of emphasis these days on tracking things. Like, there's like we wear these smart watches, and there's obviously something more elaborate which you can do, which is like get blood work done or get a DEXA scan and things like that. Is there, again, thinking of the common person, let's say, quote unquote, who is not as invested but wants to get like the foundations done, and then thinking of someone who's more perhaps invested, is there something you would again recommend, might be a strong word, but think about, or people should look into, and what sort of tracking and measurement can be helpful?
Yeah, I mean, it's hard because obviously there's so many products out there, and it also needs to be specific to you. So one interesting thing, for example, is that people coming into the hospital nowadays, if you've got a type of irregular heartbeat, for example, called atrial fibrillation, but you're not getting it constantly, you're getting it sometimes. Actually, sometimes nowadays the heart doctors are recommending, there's a device called the Cardia Live that they recommend. It's sort of a heart rate tracker, but then it's specific for that, to pick up when your heartbeat is going irregular. Yeah. And and they also can recommend an Apple Watch, slightly more expensive. I think the first one is, in the 100-ish region, and then Apple Watches are more expensive. Yeah. So yeah, I mean, it needs to be specific. Coming back to sleep, actually, there are people that use various sleep devices. I noticed you had Brian Johnson on your podcast, and these things get expensive. So, I mean, currently at the moment, I can't recommend anything really confidently, because one, I want to see more of an evidence base. Yeah. I mean, there are lots of tech enthusiasts that buy things not just for a health perspective, because they just like cool tech, like I do, with an Apple Watch. Yeah. If it has other things on it, that's great. Yeah. So, I noticed that, Brian Johnson's got a million devices. For example, with sleep, he wears some ring, I think called an Oura ring. I think I looked into it, and I was just like, some sleep scientists are saying, actually, this is total bullshit. And some of them are saying this is great. So who knows,
Yeah, and I've also seen these are like just regular YouTubers making videos comparing 3 bands who are on the same hand. Oh, yeah. They give this wildly different estimates on how many calories you've burned or how many hours you've slept and that kind of thing. So there's a very easy way you can check the lack of reliability of this, which is just...
Yeah, so I mean, I remember, because one cool thing that, a few years ago, the Apple iPhone or any smartphone has got an accelerometer in it, and it basically, through the movement, it figures out or guesstimates like how many steps you're doing. And then, people said, oh, that's not accurate. And, they tested it.
Yeah.
And then gradually it's becoming more accurate. And then they said, oh, you should get a smartwatch like an Apple Watch or whatever, Galaxy Watch. And then that's slightly more accurate. So, but then it gives you a rough idea, how much am I walking? I think it's got an error rate. I can't remember what the error rate is, but
it's probably huge though. Right. Okay. And in terms of blood, is that worth looking into, like getting annual checks, or do you think that's not necessary?
What do you mean animal checks?
Annual.
Oh, fine. Annual checks.
Like check your pets everyone. No.
Well, yeah, you should, but
No, I meant like, yearly or biannual or whatever might be useful. Is that useful at all?
Yeah, I mean, that's a tricky one. I think that's a very US concept. I think like the regular checkup. And I don't know. I mean, this is a matter for debate, basically. We don't really tend to do it in the NHS. Okay. And, maybe we should. But then equally, there's the issue of obviously time and resources. And currently, people who are sick aren't able to get the appointments they need because of various systemic reasons. And so if we then have a limited resource, then does that affect your ability to access it? So in an ideal world, yes, I think there should probably be. That's my personal opinion. But then in the current resource limited setting, should we be prioritizing sick people over healthy people? Or equally, the other side of the debate would be maybe if people had more regular checkups, you'd be able to prevent illnesses and keep them healthier. Right. That's a matter for debate. I don't know. What do you think? Would you like to see your doctor more frequently, or do you think you just want to see them when you're sick?
Right. You mean not just for blood work, for anything?
Yeah, for anything. Not just for blood work. Yeah. I mean, there are routine blood tests that we can do, but then medicine's still focused on I think you have this symptom, therefore this symptom could be all of these diseases, and therefore this is the test that we'll do.
Right.
So there isn't a like general test. We can do some basic blood tests which might pick up some things, but then sometimes it gets more specific than that.
Yeah, that's a good question. And I think one variable we sort of haven't discussed much is also like the relationship between the doctor and the patient, so to speak. Because I've had plenty of great doctors, but I've also had a small minority of doctors with whom, at the most charitable way to say it is, that was not a good fit. And there might be other ways to say it, which I will not. But I also live across countries, right?
Yeah.
So there's huge differences in also just the national recommendation or what people are aware of. So like an example would be I got some treatment done here for my dental stuff, which the doctors back home, which I go to regularly, haven't heard of. And there's just that tag team that happens, which also creates problems. But in general, I like the idea of mentorship. And this is beyond medicine, but I do have, like, let's say a psychologist or two psychologists who I trust and consult quite regularly about my mental health and social skills. And I like the idea of that happening to health, which I do not have right now. Like, there's always a GP who are very responsive and nice and great people overall, and they do answer my questions. But it also seems like there's that economic problem, right? Like NHS in the UK is quite busy. I remember one time in London, I went to the GP and they were like, your time starts now. Not in those words, but that was the vibe there.
And then you're like, timer up, bye.
Exactly. So, it's like there's that lack of communication for factors beyond the doctor or the patient in that case, or doctor and the, consultee in that case, because there's no health problem per se. So I do overall like the idea of mentorship and someone like looking over these things who knows better about these things like blood measures or whatever than I would.
Yeah, I mean, I think, that's what the general practitioner was supposed to be and is. Obviously, there are various problems going on, which I'm not going to go too much into, that are to do with sort of access to GPs and the state of the NHS right now. But yeah, I mean, that's a bit of a problem. I mean, did you find that you had more access probably back home in India?
So
for just general discussions about health, even when you were not sick? Or do you think you approached them when you were sick?
I approached them when I was sick, and quite frankly, I would think at this point I would, like, looking back, I think the trust level was low, that I had in them. And mostly, I mean, when you're young enough, then you're just, your parents are guiding you and that
Yeah.
kind of thing. But after a point, it was also about, it seemed like, I don't know, they were not as up to date, for lack of a better word. Um, and again, this is widely, there's like huge spectrum of knowledge that you get along, um, this medical area. But I've had some encounters with GPs or GPs, actually psychiatrists in this case, where there's like some people who are very open to prescribing medications, and then there's that radically different side of people who are like very conservative and
Yeah.
that kind of thing. So I personally have had mixed experiences, to answer your question in that way. But as I said, I like that idea, and I think once I have that trust and I'm confident that this person is keeping up with the science, they're up to date, they're good personality, because that matters too in some ways. I think I would like that. Yeah.
Yeah, I mean, I think it would be nice. And I think nowadays there are sort of wellness longevity clinics. I don't know. How do you feel about that kind of thing? There are various, some of them have medical professionals, some of them don't. How do you feel about like having the principle of like a longevity clinic where people might recommend supplements and this kind of thing?
Oh, interesting. Is that something that's happening, or
Yeah,
I've never
yeah,
heard
it's
of
it's
it.
happening. Yeah, it's happening everywhere basically. So yeah, but the aim is, boosting your general health before you get sick.
Got it. So just so that I understand, so I go to these clinics, and then they are looking at, let's say, my blood work or scans
Yeah.
or whatever they do, VO2 max, etc., etc., and then they're trying to prescribe supplements, or are they prescribing medications, or what are they doing there?
Yeah, I mean, I think it varies hugely, which
Okay.
is the problem. So, I mean, we can take the example of Brian Johnson, for example. I mean, I think he's released his protocol, which I think he calls blueprints, and I've looked through it, and it's like a lot of them are like vitamins and things, right? And then some of it is like drugs. So I think he's had testosterone supplementation, maybe because he had low testosterone. He's taken metformin, which is a diabetes drug, which is been looked into for longevity. And then he's taken lots of sort of some of the aging supplements that are in vogue, like NMN and resveratrol and spermidine and all this sort of stuff. Alongside a bunch of supplements. I think you've probably seen some of his videos where he's got 60 different supplements.
Yeah.
So yeah, someone like him would go, or not quite him, because he probably has a team of doctors, but someone maybe not who's a 400 millionaire will go to one of these clinics, and they might get recommended some supplementation, and then they might get prescribed some drugs which are relevant.
I like the idea, but I think hopefully there's a quality control element to it, right? That's the only hope there. So,
I mean, I think that's the concern from a lot of the medical community, right? That what's the quality control? I think a lot of it comes down to sort of like your patient autonomy, right? Like ethics wise, do you have the right to what you put into your body? Yes. But then equally, I, as a doctor, let's say I was working in such a clinic, it's, I can't give you something that is harmful. And part of the problem is that maybe sometimes in some clinics, they might prescribe you something where, the evidence base isn't as strong. Whereas in an NHS setting, for example, we wouldn't prescribe it because it's not 100% proven yet. Maybe it's halfway there,
right.
or in some cases it's completely unproven.
Right.
And that's the problem sometimes.
Yeah, unfortunately, this goes into a political debate of, how libertarian do you want the medical system to be? And I do tend to fall a bit on the more experimental side, and I do a bit more aggressive, let's say, than other people in trying out supplements, at least that are sort of sold over the counter. Yeah, I think it is a bit of a political question that we have to sort out as society more than anything else. But I personally like the idea of having more of a preventative or performance-based clinic where it's still doctors, hopefully, who are there and still have medical licenses and they go through med school or whatever, or at least relevant experts, let's say physiology or sports scientists or PTs or whatever. Physios is what I meant, not personal trainers, although that might be cool as well.
Yeah. I mean, I think some of them do have, PTs and personal trainers as well. Yeah, I mean, I think obviously some of the more sensible clinics will recommend you things that are proven or something specific to you. Like, I think, for example, like Brian Johnson was taking thyroxine, which is the thyroid hormone, because he's low in thyroid, for example. So that's specific to him. That's not like a...
You can't do that.
You can't do that. So, I mean, they'll give you stuff specific to you and some general stuff and then see. I mean... part of it is that some of it is an N=1 type of experimentation, where N is basically the number of people. So, for any intervention, this comes back to sort of the pillar of evidence, right? If I want to say that, let's say NMN is a longevity supplement, if that we think there's a hypothesis that it boosts the energy of a cell, blah blah blah. A very simplistic explanation that prevents aging or affects longevity. Realistically, if that's been seen in mice or yeast cells or whatever else, if we want to test it in humans, you need to have a trial where you say, one group will get it and one group will get a sugar pill, and both groups don't know what they're taking, and then you test a range of doses, and then you need an outcome, right? Like, so one of the things is they'll look at the levels in the blood, and then the other thing they'll look at is like your strength and your physical functioning, and then they might look at one of the markers of aging that they're nowadays looking at is something called DNA methylation, which is sort of the DNA, which is in your cell. The code of your cell tells the cell what to do and what proteins to produce and what to do. That you accumulate damage in your cells as you get older, and so part of it is that you get these little things added on to DNA called DNA methylation, and the amount we think may indicate. And there was an interesting talk in Oxford actually in November by Steve Horvath, who's a researcher who does these clocks. So it's hard because the trials are still coming out for some things or don't exist for some things, and it's then it, like you said, it comes down to this libertarian debate of how ethical is it? It's difficult because if you say to me that I don't care if something doesn't have evidence, I'm willing to try everything, but then equally it's also on me to try and recommend you things that have the most evidence.
Yes. Because,
it's unethical for me to say, actually, this probably doesn't have any evidence, but you still want to try it. I would recommend you don't try it,
Yeah. Unfortunately, I don't have answers to that. Like, just from an intuitive perspective, there is things like food supplementation, which we know that may not have too big of a downside as long as you're not like overdosing on it, and things like that, like natural sort of vitamin D take, for example, right? It's probably a good idea and it's not going to harm me too much. I know there's an upper limit to vitamin D and so on. I don't have an answer to that. I think politically, I do think we should give people as much choice as possible, but I also do see the other side of this. If one thing should be regulated, it should be medications, right? Because we don't know what the downside of that is. So I am pretty much that's all I can add to that.
No. I mean, even supplements have their benefits. So, I mean, like the famous example is Brian Johnson, right? And I think it's an easy example for people to know and look at. So, for example, he was doing blood transfusions, which is, a thing that caught huge media attention, right? And I think it's based on this principle that called Parabiosis, where what they did is there was some scientific experiment where they joined two rats together, an old rat and a young rat, and essentially the blood of the young rat, quote unquote, rejuvenated the old rat.
Right.
And they were thinking, there must be something in the blood, right? And so on that basis, there are lots of, not just Brian Johnson, lots of people across the world, mostly in Silicon Valley, I guess, that are getting blood transfusions or even components of blood from other people. Now, that's a huge risk factor because there's Is there any human studies on blood transfusion, or are these people just taking it from? Are they just inspired by the mice studies? And I mean, that's my understanding. That they're inspired by that. I'd have to look into it, but I mean, what I do know is that there's huge risks of not quite unnecessary blood transfusion, because number one, blood is not just, the components of blood. So it's like the antibodies, the red cells, the white cells, which fight infection, and lots of other things, right? So it's not just that. It's also people carry blood-borne viruses in them. People carry all sorts of things that can increase the risk of infection. And then there's lots of studies to show that, even in hospital, we were, if someone has got a low blood count, we used to transfuse them like anything, basically, just give them lots of blood. And actually there's evidence to show that increases your mortality and your risk of death. So, something like a blood transfusion, maybe that's an extreme example, but I think it just goes to show that, things come with risk.
Yeah, of course. And blood transfusion is definitely on the upper end. I think with someone like a Brian, I'm more confident in that method because, as you said, he has the resources to have a team around him who will constantly monitor. So I'm sure this is no surprise to them that this could be a risk, right? And I'm sure they have systems in place, their metrics they are monitoring, and so on and so forth. So I think at that level, I think even he himself is like, I'm going to do this first, and we're going to sort of suss out the safety, at least in n=1.
Yeah.
And then obviously it's still a jump from that to making it available for everyone. And I don't know how that jump is going to be made, at least without RCTs, so to speak.
Yeah, I mean, I think that's the thing that there's no. I think when people talk about biohacking, I sort of just describe it as things to improve your health, right? I think people think of biohacking as sort of like implanting chips, which there are people doing that and that kind of thing. So you could say like diet, like proper diet and exercise is biohacking, and then obviously people talk about supplementation and gene editing and all this sort of stuff. But yeah, I mean, it's a really interesting field. It's just more that the bigger problem in the past was evidence-based, right? And you're taking things that don't have an evidence base, and you're absorbing that risk, right?
Yeah, I think it was a lovely discussion, and we were just going into this territory naturally. But I do think it might be helpful for us to just take one step back, and think about, for the listener and even for myself, for that matter, what is this idea of optimizing for longevity? What do we know so far? What are the basic brushstrokes about longevity / biohacking?
Yeah, I mean, so obviously this has been the start of my PhD or DPhil, and just looking into that kind of thing. So I'm looking into how we can improve vaccine responses in older people. So immune system aging, you've got your heart system, the cardiovascular system, your lungs, the respiratory system. So your immune system helps fight infections. And we know that as you get older, you will have more infections, you will have a lower response to vaccines. And unfortunately, that was a problem in the COVID-19 pandemic, right? We saw it on a personal level, on a population level as well. And so we're trying to figure out how we can try and address that through understanding the systems, and then hopefully adding drugs, changing the vaccines to try and manipulate that and improve it. So yeah, just reading brushstrokes wise, what can we do? I mean, it's just optimizing your general health, obviously treating diseases, number one. There's studies to look at diet. So people have talked about caloric restriction. I mean, how much have you heard about sort of caloric restriction, and what have you read? And then we can sort of talk on that basis.
All I know is there's like intermittent fasting and a slight caloric restriction, mainly from Brian, actually.
Yeah.
So it might, I think, slow down your metabolism. I don't know. That's a catchphrase, or it has some substance to it, but slow down your resting heart rate and things like that. But it's less about what I know, right? I think let's start from this assumption of like...
No, but I think it's nice to sort of build on a basis, right? So, yeah, I mean, my understanding is that, from various studies, they showed, in cells and then moving on to mice, that if you gave these organisms, maybe just enough to survive, or even slightly less, they tended to live longer.
Yeah.
And there's all sorts of complex genes that are involved and get switched on that help, in damage repair and all this sort of stuff. And I think there's a nice book that talks about like all the bits of aging. So David Sinclair, again, the big guy in the aging field, has written a nice public science book, which I think sort of explains that, called Why We Age. Lifespan and Why We Age. Yeah. So by David Sinclair. It's nice. It talks about things like sirtuins and all these complex proteins.
Sure.
And so, it's thinking about why does caloric restriction work? We think it activates various pathways that helps you repair damage, helps the cell survive longer. This is my very basic understanding, and I'm trying to put a broad brushstrokes on it. Similarly, regular exercise has been shown to improve longevity. Those are the two important things. And then we're getting into sort of, treating specific diseases, supplementation, and then more sort of social things like, having people to interact with and a community and avoiding depression and that kind of thing.
Yeah. It sounds that this field is quite new, the whole idea of that we can live longer. And so I know there are like some maybe cultural studies that, some populations live longer, some do not, and the famous Mediterranean diet that comes from it and that kind of thing. In this regard, like, has there been, like, especially in the medical community, has there been like a shift of mood about our lifespans and things like that? Is there more like optimism about this area? Like we can probably extend our lifespan realistically now?
Yeah, I mean, there's also lifespan, but also health span, because obviously as you get older, you tend to get sicker. And now we're slowly, the pendulum is shifting towards thinking of aging as a disease rather than, people said aging is just normal. You will die at this point. It's just bound to happen. And then now you're saying actually we think aging is a general process that causes a bunch of aging related diseases.
Right.
So we're sort of trying to target it that way. And you say, actually, we think that in the heart, for example, aging of the heart causes XYZ diseases. And so if we treat aging of the heart, maybe we won't get these diseases.
Right.
And that's the thought process, basically.
Yeah. And so to look at aging as a disease, I mean, I as a psychologist, I do see the mental health challenge of that, because which is challenge in quotes, because I do think there will be because of how we treat age as a negative, this may just play into that, but that's a separate question, can be dealt with, relatively easy to deal with, I would say. But is that technically true? Like in terms of like, is aging, like, is there any reason to believe it's the same mechanism or similar sort of class of mechanism like something like a diabetes might be?
Yeah, as in you think it's a disease, or I mean, it depends on like what you classify as a natural process, right? It's sort of also like people say in the supplementation in general, like any drug treatment, they say, oh, but this is not natural. But then, you using your laptop is not natural,
or toothpaste
is not natural. So
yeah.
So what is natural? And it's the same way, right? There are these processes that we figure out, and we think that, as a cell gets older in various organ systems, that might lead to disease. So, aging is a sort of like culture, we say this is like a natural thing that's going to happen. But then, there are lots of natural things that happen that we reverse, right? You might get high blood pressure naturally.
Right.
And but we're treating it. So, I think the mindset is shifting. Whether that means that, like some people claim, the don't die philosophy, or that you're going to live forever, I don't know. Probably seems unlikely. But I think it's a nice goal to have, that we should try and stay healthy for as long as possible. I think that's probably a reasonable, achievable goal. I mean, I'd love it if we lived forever, but
yeah.
But we have to see sort of what's achievable.
Yeah. What's your thoughts on the state of the tests? There's some epigenetic type tests that Brian does and many other people do. And I've definitely fiddled with that idea of doing one for myself. But I also understand they're kind of primitive. So what are your thoughts on that? And are they indicating something useful?
So this comes down to DNA methylation. And actually, that's when we had Steve Horvath from... I think he was a California researcher. I can't remember which institution, and then now works at Altos Labs. He is regarded as the DNA clock guy, and alongside lots of other researchers. So from reading into that research, we think that looking at that marker of your DNA tells you sort of how old your body is compared to chronologically, compared to when you're born, how old you are. Yeah, I mean, how accurate is it? You know, the research is out there. I don't know is the honest answer. I think it remains to be seen. You know, there's lots of data where I think he showed us that it correlates with lots of diseases, that, you know, the higher your score, the more people have XYZ diseases. And then I think he looked at various different organisms as well. So it seems very plausible that it is a biological clock. But then there are other researchers who say actually it might not be the be all and end all. That that specific process of the DNA is not actually part of aging, and it just happens to be there, and it's correlated with an older cell and more damaged cell. I mean, yeah, to me it seems plausible. Seems like it might work from what I've seen of the research. But again, I'm not a sort of DNA clock expert, but you know, it would be interesting and nice if it becomes really regimented, like you said, where someone goes in and says, actually, what is my speed of aging? And yeah, I mean, at the moment, there's so many companies offering it. You know, what are their protocols? How are they doing the tests? That's also another problem, you know, because not everyone is doing it as rigorously as, say, they're doing in their studies.
Yeah, one thing I would say is just reading about aging, it's definitely kindled an interest in me in understanding this cell biology level of science. Because I obviously studied the brain, and even in that, I'm not studying like individual neuron and that kind of thing. I'm studying more on the higher level of like what neurotransmitters might do and what impact does it have on mental health and psychology and things like that. And a lot of my relationship with biology has been like boring classes in like childhood and that kind of thing. Whereas what this longevity thing is also a little bit of a public health revolution, in that a lot of people are willingly studying about, you know, cellular DNA and these kinds of things. So I like the side effect of this area, which it's made sort of biology cool again, if that makes sense.
Yeah, I mean, if it gets people interested in science, that's, you know, I think that's a huge positive, right? Just getting people interested in biology. Hopefully those people then go on and become researchers who then contribute, right? Or even, you know, contribute to the field in any other way.
Yeah, absolutely. So let's say we are talking to like the explorer type who is like Brian Johnson minus the money. And which it sounds like me to some extent, at least in the exploration bit. Let's say they do want to try out some things, and maybe some things more on the safer side. Let's just say like no transfusions. I'm not keen on doing that anytime soon. Maybe in some time in future, I don't know. But something as simple as, you know, like max heart rate training, which is influences VO2 max, one of the bigger indicator of longevity. What would you think some of these low hanging fruits with the longevity area? Could be supplements also.
Yeah, I mean, I think, you know, that's a nice example, max heart rate training. I mean, I don't know specifically about the evidence of max heart rate training. I think, there's a specific way you can calculate your max heart rate, isn't it? It's like 220 minus your age or something like that. And then I don't know that, I didn't know that you could increase that. So I'm learning as well.
No, I don't think we can increase the heart rate itself, but I think it might lead to a better VO2 max, is my understanding of like training at high levels of. I might be wrong, doesn't matter. But I think there is some evidence about VO2 max correlating with longevity. Is that are you aware of that?
I didn't know that. I mean, that would be interesting. Something I have to my homework for today. I mean, it's difficult to specifically. I mean, just talking more generally, if you're looking into supplementation and you're, you know, I think it's worth letting your GP know that you're doing XYZ, because let's say something happens and you get some kind of liver reaction that they don't know about it. But also number two, that, you know, I can't stop you doing what you want to do. That's your right as an individual with your body. That's fine. The only thing I would say is that just look at the evidence of what you're taking. And so if it's possible, see if there's a systematic review and meta-analysis. But again, the problem is a lot of people don't know how to analyze evidence, right? We get you know, in science and in medicine, we get training, right, on how to read a paper and how to critically analyze it, and that's a problem. So, I mean, it tends to be people who are scientists who have a little bit of this training who tend to do that. But then equally, there are people who are not well versed in sort of analyzing evidence. So then that becomes a problem, because if if people who are trained in it are having difficulties in identifying the evidence, and you say, well, actually, I read this one paper that says that, new supplement X is super amazing, and then there's another study that says it doesn't work. Right, which one is right? Right, and that's where the sort of systematic review and the whole rigor comes in, right? Because if you really want to take the supplement, the keen biohacker will say, actually, I want to take it, so I'm going to ignore study number 2, and I'm gonna look at study number 1. I say that's the right one, and then that's where your bias comes in. So try and look at the evidence from a national society if you can, for example. Following that, if you have the ability to analyze evidence, try and look at the gold standard, then follow that RCT, and then if that's not available, I would probably still wait, and try and see. There's still people who go and do something without trying it, and the problem is that when you're testing out on yourself, you don't have the objectivity, because all you know is how I feel, right? But how you feel could be because of 100 million different things, placebo effect. So it's hard.
Yeah. Makes sense. Yeah. I think you're completely right in that a lot of the reasons why I have been able to experiment a little is because I have some sense of how to evaluate studies, and having done that as part of the PhD training, which I absolutely cannot expect from my grandparents, something like that, right? And that might be an interesting question. I'd be curious to hear. Like, I have family members, grandparents, etc., who are obviously aging, and ask me about advice about what do I do for my brain health. You're the expert, kind of thing. And that aside, that I'm not exactly an expert in what they're asking, is there things that you would suggest your relatives, like that kind of thing, who ask you for some advice, like, hey, I don't know, something like walnuts or omega-3s is where I'm getting at with brain health.
I mean, I think it would be specific to their thing. Sure. So let's say they've got heart disease, or they've got, I don't know, something else. It needs to be specific to them. Generally, that's why it sounds really vague and annoying, but I promise I'm not trying to be. And then someone asked me this recently, actually. She said, oh, well, would you recommend rapamycin, which is this, this anti-aging drug they're now doing a trial of it, for example. There's a professor in Oxford, she's doing a trial. Professor Cox is doing an interesting trial on low-dose rapamycin in older people. And so rapamycin, it's I think it's from the Easter Islands. It's based on those PEDs, I think, and it's a drug that acts on a specific pathway in cells called mTOR, and then it helps aging, basically. But actually, similar drugs of that nature were then used in transplantation. So, when you're giving someone a transplanted organ from, let's say you gave me a kidney, my body's immune system says, this is not my kidney, this is Sankalp's kidney, and attacks it. And so you say, calm down, immune system, and you try and get the body to accept the new organ. So we call this immune suppressing drugs. So rapamycin, similar drugs to that, like tacrolimus, for example, or everolimus, sirolimus, this kind of things are used for organ transplantation. But then if you think, if I'm really dampening down your immune system, we get this cool aging benefit, but actually I'm increasing your risk of infection significantly. Normal infections that you or I might fight, but then someone who's immunosuppressed. So, and so that's why these kind of things come with problems. So when you said, would I recommend it to an older person? I think I'm protective of my family in the sense that whilst I might be willing to sort of do more of an experimentation, or you might, right? Because you say, well, I'm young, the probability of something happening to me is slightly lower, still there. But then your older relative who is 65 and has got 3-4 different conditions, I get a bit more wary of recommending them things that aren't specific to them, but then also experimental stuff, right?
Yeah.
How can I recommend rapamycin when they're still doing a trial?
Yeah.
They don't know what dose is going to work. They don't know whether you're going to become severely immunosuppressed with it, right?
Yeah.
So and you know, it'd be great if it works, and why not? But then that's why we have these things, because you know, people get sick if you don't test properly.
Yeah, I think in the case of like relatives or elderly people asking me at least about these things, I think the recommendations on the foundational health side are much more easier to.
The foundational health.
The sleep exercise,
the easy
stuff
boring stuff, sadly.
that we heard them telling us. There's what we can sort of play the reverse card there.
Yeah. You're like, see, now I can tell you, all that diet advice, I'm reverse Uno and give you the diet advice back.
Absolutely. So I think we should start wrapping, but there's this one topic that I do want to briefly touch, at least because it is also like longevity, which is making a lot of like buzz, which is the gut microbiome. And as a neuroscientist, I have a perennial fascination with the fact that a lot of neurotransmitters are now, we've discovered, created in the gut. But also there just seems to be a lot of like immunity or general health related things happening in the gut microbiome. So if you could just tell the listeners what it is, first of all, and then what do we know about it and why the buzz?
Yeah, so the gut microbiome is hugely interesting. So my understanding, and there are really cool researchers who are doing specific gut microbiome researches, that basically it's sort of like another organ system. You've got all these bacteria that reside inside your digestive tract, basically. So your digestive tract starts with your esophagus, goes to your stomach, your small intestine, large intestine, comes out rectum, back passage out below. So there's all these bacteria that are living there. And this is where this principle of sort of good and bad bacteria comes from. And so we think that there are good bacteria that help all the cell functions that go on. It helps your gut immune system. And then, like you said, there's really cool new evidence to say that actually your gut microbiome influences your neurology, your brain functioning. It's a huge topic, and it's still not that much known about it. So for example, like in inflammatory bowel disease, so that's Crohn's disease and ulcerative colitis, where your body's own immune system attacks your gut. One of the treatments that has been proven to work is that it's called FMT, fecal microbiome transplant. And so what they do is they take essentially your healthy, quote, gut microbiome, and they give it to someone who, theory, may not have a healthy microbiome, and maybe that's why their immune system is dysfunctioning. And then they found that works. Again, it comes with its own risks, because some of that bacteria might go into your blood, cause an infection, etc. Or it might not work. So and the concept is actually quite, in a way, not very nice. You're, essentially swallowing pills of someone else's poo. So I mean, there's lots of research going on into sort of how it affects different diseases. I mean, what have you sort of read and what have you thought about it? Because I'm sure people have probably recommended, you need to take this probiotic, or like eat more kefir, or like have more yogurt or something. Yeah, what have you sort of read and thought about it?
Yeah, there's two lines of reading and thinking about it I've done. One is more on the personal day-to-day life side, and the other is actually on my PhD and more serious sort of mental health side. So on the personal side, I understand whatever you said about, there's germs, quote unquote, in us which are good and bad. I've actually done a microbiome test myself. Horrible results now, but I did at that point. I had a recent antibiotic treatment, so may not be the most representative. But at the same time, I did read more about it, like the kinds of bacteria I did not have and did have. And it was not clear why this one was the bad bacteria, because it clearly has some good sides to it.
Yeah.
And so, the classification didn't particularly impress me. But broadly speaking, there is the gut microbiome. It does produce neurotransmitters, especially serotonin. And as we know, there is some role that serotonin might play in depression. What that role is, it's certainly not simple in terms of like low or less serotonin leads to depression and the other way around. But probably plays some role. And obviously the drugs that target depression target serotonin. So there is some reason to believe that it might influence your mood and your overall, certainly digestion and things like that. I don't know where the evidence for immunity comes from, but I've heard that it influences the immune system. And then obviously on the recommendation side, I went this morning and bought some kombucha,
Nice.
which I would not do had I not been reading about these things. And again, kombucha has other problems like dental health and all of that. Which
Yeah, it always cues the old like advice because, as you know, like in Indian culture, we have this yogurt tradition, right? And so obviously, I think I remember in med school talking about gut microbiome, and then obviously the family's like, "See, we've been telling you this for years. Like all this yogurt that we eat is amazing." And I was like, "Yeah, probably right."
yeah, the full sugar yogurt. No,
Well, yeah, the full sugar. No, I mean, yeah. Let's take the sugar out of it, but yeah.
Yeah, no, I do think that there is, and I think even subjectively, you do feel a difference when you eat fermented foods. I do feel it at least. So I'm optimistic. But on the more science side, which is also very interesting, there's this study that I reviewed a few weeks ago, which took people having social anxiety, and this was done out of Ireland, and I forget exactly where. I think Cork in Ireland. But anyway, they took humans with social anxiety group and non-social anxiety group, and they took their microbiome and they transplanted it in mice. And what they found was there was like a very clear, I would say, transference of symptoms just by the transfer of the microbiome. I do believe they did fair amounts of control, like they wiped the microbiome before, so that it's not just like so I mean, scientists doing their thing, trying to control to the best they can. There's problems with that, of course, but I do find it fascinating that you could just take a sample of poop from humans to mice and you see
and it just sort of lends some weight to that hypothesis that, you know, something is happening in the gut where, I don't know, whether it's neurotransmitters or it's affecting the nervous system or hormones or I don't know what. I mean, there's lots of, so now in a lot of, so prior to the research I was doing here, I was sort of looking at autoimmune encephalitis with another professor. And so, you know, and
what is that?
So that's like so that's basically your body attacks the brain.
Okay.
And there's a nice book called My Brain on Fire, which is about that, but that people can read. But essentially, we're looking at like autoimmune diseases, and nowadays people are adding an analysis where they say, let's look at people's poo sample basically and say what's different, like which bacteria are like, you know, more disease causing and less disease causing, and then, you know, maybe that will lead to something down the line. But yeah, it's super cool research that's going on. I mean, in terms of advice, I think I have heard, and I'm by no means an expert in this, that, you know, eating a varied diet, because there's probiotic, which my understanding is that basically you're promoting good bacteria. But again, what is good bacteria is like a huge debate. And there's prebiotics, which is like they say that the diet that you eat feeds certain types of bacteria and others. And they say that having a more varied diet allows, you know, if you're just eating like the French fry diet, like you're saying, every day,
the gold standard.
Yeah, the gold standard. Then it's probably not going to promote like the other good bacteria that need other things to survive, like other nutrients to survive, obviously. And then, fermented foods, kefir, yogurt, you know, kombucha, all that sort of stuff.
Yeah, likewise. There's a nice, if people have a subscription to Masterclass, there's a gut microbiome Masterclass done by leading researchers in the area. I think Justin and Susanna Sonnenberg are two publicly known scientists, at least in this area, and they give out similar recommendations of like have a variety of fruits and veggies, fiber most importantly, and then fermented foods and that kind of thing is helpful.
Yeah, exactly. I think obviously then like you said, there's always the more extreme end where people are trying to get microbiome transplants, and you know, I think in the specific context of a disease where it's like heavily regulated, that's fine. Obviously people are doing it without that, then there's some problems with that. So
yep, makes sense. Right, is there anything I should have asked you that I have not?
No, and is there anything else that you wanted to ask me or that you were wanting to talk about?
I would ask you a quick question about what do you think about this whole area of personalized medicine. So we talked about N=1, and there's clearly a lot of like startups, AI based. So I don't have like a specific question, but do you have any like thoughts, or do you want to riff on personalized?
I mean, I think it's really cool. I mean, it's the future, right? So we can give an example of cancer therapy, right? So let's say you're unfortunate to get diagnosed with a cancer. Let's say you get a specific type of lymphoma, right? And it's already happening. Previously, you'd say, we know that cancer cells divide really fast. So what I'm going to do is I'm going to make all the cells stop dividing really fast. And that's the principle of chemotherapy, right? But then you're affecting your normal cells. But, then we know that some cancer cells have specific markers on the outside. So then we develop drugs to bind them. But your cancer cells might be having different markers than my cancer cells. And this is where personalized medicine comes in. And, we do have that technology where, so for example, like in blood cancers, they've got something called CAR T cell therapy, which is basically you target your own immune system to attack your specific cancer, not general cancer,
right?
Because your specific cancer might have something that no one else's cancer has, and it allows specific targeting. And, it works. Sometimes, there's still trials going on. But yeah, huge, cool area of medicine. And yeah, hopefully in the future, we have this thing where you say, actually, I've done a genetic analysis and I think that based on this, I'm going to treat your disease, which is specific, has got these markers and these genes, and I'm going to target you with this. But again, these personalized medicine is hugely expensive because you've got to develop a treatment, not quite almost for you specifically.
Yeah. And, so I'm going to keep this rapid fire.
Yeah.
The second one is your riff on Ayurveda / alternate medicine, Chinese medicine.
Yeah. I mean, so, coming from Indian culture, Ayurveda is talked about a lot. The principle that herbs are better is, I think, a problematic concept because, and yes, we do get medicines from herbs, right? So for example, paracetamol or aspirin, for example, was tree bark, right?
Right.
So, we do get it. The problem with herbs is that herb doesn't have just your cool drug of interest. It's got 10,000 other things. So when you take a herb, your body takes not just that, but it takes everything else. So that can damage your liver. And, there's, for example, social media followers might follow this guy called Liver Doc, who's like an Indian doc who does that. So, yeah, evidence base is lacking, basically. I have no problem with her. People can do what they want, ideally, but people should know the risk that when you're taking a herb, you're getting everything else. And then the problem is that a lot of Ayurvedic herbs, not naming specific companies, are grown in soil which has heavy metals, so like copper. And then, so basically the samples get contaminated. That stuff is dangerous for you. Yeah. So, holistically, you should approach medicine not just like as drugs, thinking about the mind and everything. Great. If you want to take what you want to take, that's up to you. But understand the risks, understand the evidence-based, number one, that it might not be there for herbs. And then taking a herb that might have been proven to do something, you're also taking everything else that comes with it. So
absolutely. Yeah. I mean, there's a very tiny intersection of herbs and evidence-based things, which are quite cool, like turmeric, for example, and ashwagandha has some evidence, I suppose. So there is a small intersection there of herbs and evidence-based things. The one anecdote I can think of is when I go back, there is this idea that just because it's chemical free, which I don't even know what that means. Like, what does it mean for a toothpaste to be chemical free?
So what does that mean? It's just like herbs have chemicals, right? Everything, So it's just that's what it slightly annoys me when people are like, oh, this is natural, and I was like, well, but then you say, well, if we were living in the hunter-gatherer age, it was natural for you to die at age 30 because of whatever disease. So
Yeah. My pet peeve was natural toothpaste, which do not have fluoride, which do not have hydro appetite kind of thing, whatever. That's the new thing. But so I don't know why that's working. Like, it's just a concoction that people hope will work, right? That kind of thing. And
and so that's why, like, this specific doctor, he's sort of quite famous. Because he talks about the dangers and the safety, and obviously problem in India is that it's a huge multi-billion-dollar industry, and where there's money involved, there's legal threats and everything else. So I think that's good enough. So I think do you have anything else to add to any of that? So what I would say is just like
we did cover like a lot of ground there, and for those who thought that we might just talk about the boring exercise stuff, would be pleasantly surprised to where we sort of went to. So just would like to thank you for all of this information, right from like sleep, exercise, medicine to the common cold to the gut microbiome, and we talked a bit about longevity. We talked about measurements and tracking and personalized medicine. So we covered a lot of ground. So thank you for the knowledge and the expertise.
No,
and
thank you. And I just want to
experience.
say, yeah, hopefully, if you want to know about specific things, hopefully we can link some book recommendations.
Sure.
I can't remember who the author is. I'll probably tell you afterwards. There's a gut microbiome book basically as well, and yeah, just follow your national guidelines if you're sort of not, and try and look at specific subject matter experts and what they're saying. And then try and look at the evidence, basically, if that's all like in part, basically.
All right. Thanks for your
Thank you very
time
much.
today.